Sacubitril is a drug used for the treatment of heart failure with reduced ejection fraction. Sacubitril is the most well-known drug in a class of drugs called neprilysin inhibitors. There's a lot to know about sacubitril, so let's dive right in for this mnemonic so you can learn everything you need to know for test day. It seems like aliens have arrived on planet Earth, and they have started by exploring the ocean. But these are some pretty human-like aliens. They even have scuba gear. You can use this scuba gear, or scuba diving, to remember Sacubitril, or Scubitril. Get it? Scuba for Sacubitril? Now that we've set the scene, let's talk about how Sacubitril works. This alien has wasted no time to gather specimens for analysis. See the little net in his hand? Yep, this net is here to help you remember neprilysin. Neprilysin, get it? Neprilysin is an enzyme that breaks down peptide hormones including ANP and BNP. Just like a net inhibits whatever it catches, sacubitril inhibits neprilysin. So by inhibiting neprilysin, sacubitril increases ANP, BNP, and angiotensin II levels by preventing the breakdown. We'll talk next about what effect this has on the body. For now, just think back to this alien's net and that he's trying to catch, or inhibit, fish from escaping. And you'll never forget that sacubitril is a neprilysin inhibitor. How is he even attracting these fish? He doesn't have bait. Whoa, what's he doing? Peeing? Didn't they always tell you not to pee in the water because it attracts sharks? Well, it looks like this alien wants to attract animals with his alien pee. Let this alien pee remind you of ANP, which stands for atrial natriuretic peptide. ANP is a hormone typically produced by the atria of your heart that decreases blood pressure through peripheral vasodilation, natriuresis, and diuresis. This makes sacubitril useful for treating volume overload in heart failure. It's important to mention that for sacubitril to effectively treat heart failure, it needs to be given with valsartan, an angiotensin II receptor blocker, or ARB. This is because angiotensin II levels are also increased by neprilysin inhibition, and angiotensin II does the opposite of ANP and BNP. It increases blood pressure by way of vasoconstriction. Looks like our alien caught something. It looks like a pufferfish. Say, do pufferfish usually look this red and swollen? This angry, puffed up pufferfish should help remind you of angioedema, an adverse effect of sacubitril. Angioedema is the swelling of the deep layers of the skin. Just like the pufferfish, this tends to be around the lips and eyes. This adverse effect of sacubitril is compounded by concurrent use of ACE inhibitors, another drug that also may cause angioedema. This is a reason why sacubitril is contradicted in patients taking ACE inhibitors, but we'll talk about that in our next symbol. Next, take a look at the alien spaceship. Notice how it's shaped like an ace? Let this spaceship remind you of ACE, as in ACE inhibitors. However, be careful here. Sacubitril is not an ACE inhibitor, but is rather contraindicated with the use of them. This is because sacubitril can exacerbate the side effects associated with ACE inhibitors, such as angioedema, as we just talked about, as well as hypotension, dizziness, hyperkalemia, and cough. That ACE ship is getting awfully close. Let's wrap up before it tries beaming us up as specimens. Sacubitril is an antihypertensive medication used for treatment of heart failure. It works by inhibiting neprilysin, an enzyme that normally breaks down peptide hormones such as ANP, BNP, and angiotensin II. Paired with valsartan, which blocks angiotensin II activity, sacubitril increases ANP and BNP levels to promote vasodilation, natriuresis, and diuresis, effectively lowering blood pressure and volume overload in heart failure. Adverse effects include angioedema, hypotension, and dizziness. These side effects are exacerbated by the concurrent use of ACE inhibitors, which are contraindicated for use with sacubitril. That's it for sacubitril. Mission complete. I'll see you in the next one.